everyone, thanks so much for joining us on Giving Tuesday. I'm Rebecca Michelin, Director of the Wildlife Clinic, and this is Chris, our Assistant Director, and we're going to be going through the process of changing some foot bandages on a ringneck pheasant today. So our pheasant came to us, somebody actually saw him get hit by a car, and when he came to us, it was pretty obvious that he wasn't a wild pheasant. So he had his wings clipped, and he had his spurs clipped, which are the sharp talons on the backs of his ankles, and, sorry, excuse me. And he was in pretty poor body condition, so though he was clipped by a car, he didn't have any serious injuries from that. One other indicator that he wasn't a wild bird, that maybe he escaped from a meat farm or was owned as a pet, is that he had bumbles on his feet. And bumbles are infections of the foot pads that can become very serious if the infection spreads into the bone and the surrounding tissues. So they require daily bandage changes with lots of padding and support to help take the pressure off of those sores. So what we're doing now is removing the bandages. He has these changed every day. And we save them because we've got little specialty boots made out that form to his feet. So you can see on the bottoms of his feet there, he has some soft spots with scabs. And those are the bumbles just starting to develop. Those ones are still fairly new. And this usually happens when a bird is kept on an improper substrate. So he's either kept in a cage or he's kept somewhere where he doesn't have a lot of variety in the surfaces that he's standing on, and it creates soft spots on the padding on the bottoms of his feet. Where's the edge here? So over time, those soft spots can become infected when the skin is compromised and the bacteria gets underneath. And there's not a whole lot of tissue or muscle on the bottoms of the feet. So an infection in the skin can easily travel right into the soft tissue and into the bone. So it's important that we catch it early. Unfortunately, his bumbles were still already fairly developed when he got here. So it's going to be quite a long process. It can take several weeks, up to several months of daily bandage changes and treatments before those completely disappear and heal. Doesn't want to come off neatly.
Yeah, of course, we want to wrap the feet very securely so he can't get the bandages off, but that can make it a little tricky to change them.
He's in a towel right now.
He's currently wrapped up in a towel. We will get a chance to have a look at him when we give him his medications, but we don't have him sedated for this process. It's because we do it every day and we've gotten quite a process down. It's easier and less stressful on him not to go through the full process of sedation if we can do the bandage change quickly and easily. All we do is we keep his head covered, we move as quickly as we can, and normally we wouldn't be talking during this process so that it would be as stressless as possible. There we are. So you can see on the bottom of this foot, he's got a bumble that's significantly larger and the tissue's quite swollen, but it has already come down quite a bit from what it looked like when it came in. So first we're just gonna soak his feet for a couple of minutes in an antiseptic solution in warm water to help soften those up a little bit. And while that's happening, I'm going to prepare his shoes to replace them. So one of the things that we are looking today for your support is to help us improve these kinds of treatments and our diagnostic capability here at the clinic. So while we're not using it right now, we do have our anesthetic machine here and ready to go, just in case he does get overly stressed and we find that sedating him would be helpful to completing the process. So our anesthetic machine was donated. It's a used piece of equipment and it's been through a lot. We use it on a regular basis for a lot of different reasons, a lot of different procedures. Sometimes animals, when they first come in, would benefit from just a mild sedation to help them get through their physical exam, and other times we've got treatments, bandage changes, and surgeries. So with our anesthetic machine, there's two ways of getting the oxygen and the inhalant gas into the animal. One way is through a face mask, where the animal's whole face or head goes in through the hole and they're breathing the gas that comes out of the tube. The other option is an endotracheal tube like this, which is actually inserted into the trachea of the animal and is hooked up to the machine so that they're getting the gas directly into their lungs. Our endotracheal tubes, we can reuse them, but they're, a soft kind of silicone or plastic, and they do wear out. And we are in need of some new ones in some smaller sizes for some of our smaller patients, especially for birds and small mammals. And some of our face masks, because they need to be sanitized thoroughly every time they're used, the plastic does crack and wear out, and you can see our masks have got some tape on them to repair those cracks and make sure we're not leaking gas during the process. So we'd like to be able to replace some of our face masks as well, and we're hoping that you'll be able to support us today on Giving Tuesday, or anytime you have the chance to help support the clinic, so that we can repair and replace some of our medical equipment here. So while he's finishing his soak, I'm just going to get his little booties ready. We've made a little donut out of a casting material with some surgical foam on top, and that allows his foot to sit nicely in this little donut, and that's what's supporting his foot and taking the weight off of those soft spots on the pads of his feet. And that's for the most severe one. He has a full donut. For the other one, we're just using the surgical foam as a nice gentle padding on the bottom of the foot. So the first thing we're going to do is cover the bottom of the foot with an antibacterial ointment. To again help protect that tissue, make sure that it's kept nice and moist, and to prevent any infection from spreading through the area. And we use a non-stick pad to cover it, secured with a little bit of tape. And then we replace our shoe. And again, I'm making sure that that injured part of his toe is right in the center of that little donut. And we wrap it with a little bit of cotton padding, the same way you would wrap a cast. Is he doing okay?
Yep. He appreciates the warm water of the foot soak, but does not appreciate being removed.
No. Like a little birdie spa treatment.
Yeah, while we're restraining him for this, I'm trying to pay attention to, is he breathing heavily? Is he vocalizing? You know, it's normal for them to resist. His feet are sore. He doesn't want us messing with them. But you know, you just want to make sure that they're not getting too stressed out. So we've been covered up like this. It's important to pay attention to how they're doing. He's doing all right. He's not loving it, but again, his feet are probably pretty sore.
I'm gonna start up just a little bit higher. Good. So I mentioned earlier that his spurs were cut, so just like roosters, the male of the ringneck pheasant has a spur, which is like basically a big talon right at the base of his ankle here, that they use for fighting when they're in territorial displays or fighting other males for females. So those were trimmed, which is not something that would normally happen in a wild ringneck pheasant, which again indicated that he was probably kept as a pet by someone. And this is the final layer, which is just a cling wrap to help hold everything in place and protect the bandage underneath. Only leave his little toes out for comfort, but also to make sure that he's not having any excess swelling because of the bandage. We're not wrapping very tightly, but we want to make sure we can see his toes, make sure that they don't swell up. So there we are, a nice padded shoe on the bottom of his foot. I'll put a little tape on it just to secure the bottom. There we are. We're going to quickly repeat the process on the other foot. You doing okay?
Yep. It's nice to see how much more comfortable he is with the shoes once he goes back. He's not limping on them. So that's another important part, is they have to be able to stand pretty normally with all of this padding. Otherwise they can develop other problems, you know, if their posture is bad. So we have to watch out for that too when they go back in their enclosure, just to make sure everything is sitting right on the foot.
And while he's with us, as with all of our animals, husbandry is very important. We make sure that he has a well-padded cage. We do have to restrict his movement a little bit so he's not walking too far on these feet. But he's got a well-padded cage. We've got several different surfaces for him to stand on so that he can evenly support his own body weight. We also make sure that he's getting a proper diet. He gets pain medication and antibiotics several times a day. Even something as simple as monitoring his weight, making sure that he's not overweight, because being overweight or underweight will change how he heals and how he stands on his feet as well. So there's a lot to consider, even with something as fairly simple as little foot sores.
Was his weight normal when he came in?
He was fairly underweight when he came in, so he has been gaining weight at an appropriate pace since he arrived. And we've been supplementing his diet with some enrichment. Again, since he's housed inside, he doesn't get to be outside foraging for his own food, so we do provide fresh fruits and vegetables. He gets insects, as well as lots of grains, which make up a big part of their wild diet. There we are. Booty number 2. So now we will get a quick glance at his face while we give him some medication. You'll be able to see his beautiful feather coloration. So his feathers were in pretty poor shape when he came in as well, but he's been growing them back in nicely. Sorry, little bud. Good. All right. Thanks, little bud. See you later. Thanks very much for joining us, and we hope you'll tune in again later for today for a few more videos about our medical and treatment process here at the clinic. So have a great day, and if you'd like to visit our Facebook page or our website to donate and help support our cause today, we'd really appreciate it. We'll talk to you soon.